got about 2 after. We may pick up a few other people here joining in, but just wanted to welcome everybody back again. I was looking back, it's really been 6 months since we last met, and apologize, some things kind of got away from us, and I know everybody else has been incredibly busy as well. So thanks everybody here for being patient and then joining back in again. So I think really we'll kind of use the same format we've done before. I've got a couple topics we can get into today, but really just wanted this to be an open discussion again for us to bring forward any questions, concerns, ideas that we're working on to be able to share them with the group. And then I also asked Jigger as well to spend a few minutes and just talk through anything new that Cerner may be doing in the physician space and provider space. I know there's a lot of changes going on right now through Cerner, and allow him a few minutes here to talk with some of maybe the innovations that are going on in that area. What I thought maybe we could start with, since it has been 6 months, I know a lot of initiatives may have taken place. I know I'll kind of be putting everybody on the spot, but maybe we could just go around the group here and just kind of give us a level set on where we currently are, and then we can get into some specific questions that people may have, or really any ongoing work or anything that's been completed in the past few months. And I think that may trigger some further discussion as well. So Paul, I know you were one of the first ones to jump on there. So, and I see Sandy, you're on now. Do you want to give us some updates on Concord?
Yeah, well, we're our hospital back in May 1st acquired 2 nearby hospitals and 30 associated practices after they had gone through a bankruptcy, and they're now part of our health system. We're now a 3-hospital health system, and the other 2 hospitals and practices were on Cerner like we are, but we're on a different version, a different build of Cerner. So right now we're in the middle of a big project to combine to get onto one instance of Cerner between all the practices and all the hospitals. And in fact, Brian Cottonsteady is basically leading that project here. So we're going through all the things that we need to go through to go from being just a standalone hospital to being a health system.
I think as important as that, Paul, is that your new role as well.
Yeah. And so in the meantime, Paul Clark, who you guys probably know from past CMIO meetings, stepped down from his position as CMIO on July 1st, and I got tagged to take over that role. So I'm trying to figure out how to do that. With this project as my first thing to start with, so it's awesome.
Certainly hitting the ground running.
Yes.
Wow. Great.
Oh, splatting, right?
Thank you. Dr.
Hey,
Halim?
Brian, I just was going to jump in, if possible, and see, is part of the Laconia and Franklin transition, one of the big initiatives that we're working on is a VTE, venous thromboembolism assessment tool. And that's something that they currently are using at the other facilities, and we do not have a VTE assessment tool here in Concord, but it's something that our providers have requested. So I know that Cerner has a module for a VTE advisor, and then other facilities have kind of done their own thing. I was just hoping to kind of crowdsource from this group a little bit what individual facilities are doing for VTE risk assessment. Do you have a risk assessment tool? Do you use one? Do you use different ones for different specialties? And how do you kind of bake that into the provider workflow in terms of order entry and where in the process you do the risk assessment? I'd love to hear if anyone has any suggestions, or if you want to move on with the meeting, Brian, I'd love to have people send me anything they have offline.
Yeah, I mean, we can jump off and go into that, and we can kind of continue going around through everybody as we go through this. But yeah, we can certainly open it up to what others are using for the VTE assessment tool or the risk modules.
This is Dr. Mandy Holford with Covenant Health. We do use Cerner's VTE Advisor. I will say we implemented it as model, but we really went back. Probably we did it with our Cerner implementation, but we went back maybe a year after go live and did an optimization project all around VTE. I think what we learned is that the rules, aren't necessarily the best way to alert the provider on admission. It's better to incorporate those orders into the power plan. And then if they're not addressed by the first 24 hours, then use the rules and alerts. So we do still use all of the advisor content and do believe that it's helpful, and our metrics have continued to improve. It's just that front end piece, and Jigger, you may have a further update on if models change since that time. But I think it's, what we heard loud and clear is we needed to incorporate the original orders in the power plan and use the kind of rules alerts if we didn't, follow best practice on admission.
And Dr. Halford, do you do any kind of risk assessment then at the time of admission when you're placing the orders, or does that only fire after if it hasn't been addressed?
Now it only fires if it hasn't been addressed, because what was happening is some of those were more open chart alerts, and then even though we went back and added a defer button until the doctor was ordering on the scratch pad, they still didn't have all their documentation complete, either from a nursing intake perspective nor from a provider perspective, and a lot of it's driven off documentation. And so it was, falsely advising them of what to do or not do, and just, kind of became a noise and a nuisance. That's why we don't alert them unless they didn't address it, and kind of put a time delay on that original open chart alert, if that makes sense.
Thank you.
Yeah, Mandy, to your question, I don't have any knowledge of any model updates, but I think what you've expressed from a workflow perspective, over alerting, especially when it's the first time you're going into a patient's chart or that sort of thing, is problematic, and you've remedied that at Covenant. I'll take a look and see if there's any other changes, but I think Paul and Sandy, I think following Covenant's approach is a good approach. It's been vetted. They have experienced the original content and have moved forward. I don't know what Laconia or Franklin have done, if anything, to modify that either.
Thank you. Yeah, Laconia and Franklin had done some of their own build on that.
And it's probably similar to Mandy's, is my guess.
Yeah, they don't specifically use the VTE advisor. They actually fire a power form. But the workflow is pretty clunky in terms of the fact that they place the orders and then the risk assessment tool fires. So it's a bit backwards. But we are sort of committing to try to do some sort of risk assessment. It's something we've been thinking of for a while, and as part of the transition, I think we need to try to make that happen.
Great. Sandy, thanks for bringing that up. That's a good one.
Thanks for letting me jump in with that, Brian.
Of course. Dr. Halid, I was going to go to you next since you were the next one on the call. Did you want to give us an update on how things have been going for you? Oh. Still there? You might be on mute.
Oh, hi.
Hey there. I can hear you.
Regarding Sidra, we are basically now doing a big project for the system upgrade. So we are heading from code 15 to 2018. And also we are doing refresh for all infrastructures, systems. And also we are doing the transitions for the coding systems. So we are doing like a lot of activity this year. So we are planning to go live second week of December with 2018. In addition to this, we are doing a lot of optimizations for the workflow with this technology. We updated our system regarding the sepsis, alert, and now we are planning to go ahead with the precision medicine and utilizing AI. But this one, it will take a lot of time. So we just started now another project for images AI, and also studying some of the clinical notes to identify an algorithm to help physicians for diabetes and also for supporting for predicting sepsis. So this is the ongoing project that we are working on now in CIDRA.
Those tools that you're using and the AI that's helping with diabetes management, predicting sepsis, I mean, are those tools from Cerner or are those other tools that you're using?
No, it is, we are also working with Cerner in this regard, but also we have our team that we are working with. And also we have other partners who basically they are a scientist. So we are working with them to identify. So we do a lot of collaborations. We give them the data and they work on this and we do the testing. So we are working on this. So this is maybe, it will take us a lot of time. But regarding the precision medicine, now we are working on with Cerner to identify a vendor who has the partners with Cerner to help us to be able to incorporate the genomes that we have into the clinical workflow for the patients. So then it will be easier for the doctors to utilize the genomes studies into the clinical care for the patients.
That sounds like an amazing thing you're doing there. I think maybe as you get further along, that would be really cool to bring back and show this group more of what you're doing with that.
Yeah, I would love to see that down the road. Well.
Yeah. Yes. So this is just like planning, but as of today, now we are focusing on the code upgrade and the system refresh, and probably next year we are going to go to do like the precision medicine. Still, we didn't make the decision yet about the vendor, but this is like an ongoing discussions that we are doing with Cerner team. And the AI, it's a long journey. So we are working till they identify something is working. But of course, yes, we will keep you updated about the ongoing things that we do. Thank you.
All right, Dr. Halford, I'll move on to you and Covenant.
Hey, thanks, Brian. As you were asking the questions, I was sitting here thinking there's so many projects that we're working on right now. The biggest of which, from a Cerner perspective, is our annual code upgrade and M-Page upgrade. So we're going from 2018.01 to 08. That will go live in early November, but we've had lots of additional Cerner-related projects this year, including telehealth focus with Amwell and Cerner, working on multiple projects there. Worked on an essential clinical data set rebuild on the acute side, which is a big win for nursing. We are still in the thick of our wave 2 for COVID, and so it's continuing to be all hands on deck. Thankfully, the numbers are finally starting to go down, but we've built surge bed, nursing crisis documentation, you name it, the list goes on and on and on in response to COVID. So fast and furious and always fun.
Yeah, absolutely. I know on the CMIO discussions or the roundtable that we had last month, there was a lot of discussion from the groups about using the Cerner Upgrade Center versus sort of trying to do some of these things internally. And I think sort of the consensus was it's an expensive project, but people didn't quite feel comfortable about taking any of those on themselves. But really sort of testing was the piece that everybody felt like they still needed to hold on to. Upgrades are still a major for everybody to go and do, and they hit every year. So I don't think I've seen anybody yet that has a good answer to how to continue to do those upgrades and not make them be so impactful to the whole team.
Right.
And Northside, I'm not sure. Ray, did you want to bring anybody up to speed on what's going on with Northside?
Sure. Thanks, Brian. Lots of going on also on our front here. One of the biggest focus we're doing is our Cerner rollout and our ambulatory practices. So currently we have rolled out Cerner to 35 practices spanning 97 locations with 237 providers. So that's kind of our big push right now, is to try to move all our ambulatory clinics to Cerner. You mentioned upgrade. We recently upgraded to the 2018 version of Cerner. So that has been successful. I know biggest challenge we had with that upgrade, so everybody is aware, I don't know if you guys use FetalLink, but FetalLink was a big issue for us during the upgrade, just because predominantly maybe because of our volume. So we are down with one issue that we're trying to fix, that Cerner has provided a code fix for us on that one. And then lots of integration work with third-party software like Paratrend. So we're doing an upgrade of the Paratrend, which is the early warning system from Rothman Index Parahealth Company. So we're doing the upgrade for that in 3 of our facilities, and roll out to 2 of our other facilities. And then also, I don't know if you guys heard of Peri Watch. That is also another early warning system that we are trying to implement as well for our women's group. So it's also an early warning system that kind of lays on top of FetalLink. So it's kind of more like a central monitoring unit, cardiac telemetry type setup, but more so on the OB side. So we're also kicking that project off, among other things, and we're doing a lot of women's health optimization, just because we're a big baby hospital. So those are kind of just the high level we're doing, Brian. But there's other things that we're doing, like we did circumcision dashboard. I know Cerner has interest for us trying to share that with other facilities that has attempted to kind of do that. So there's a lot of work, customization that we're also doing, but very busy from our end.
Yes, absolutely. Thanks, Ray, for the update. And then, Jigger, did you just want to spend a few minutes, or I'll give you the floor here? You can talk about anything that's going on from a Cerner perspective.
Yeah. So first and foremost, many of you know or have heard, Dr. David Feinberg has joined the company on Friday, October 1st, as the new CEO. Dr. Feinberg comes from a background in child psychiatry, but also led the UCLA health system. Geisinger Health, was most recently at Google Health as a vice president there, and has come on board and hit the ground running at Cerner. First day, I happened to be with a client in Kansas City, and he stopped by on his very first day. I gave 15 minutes. Very engaging individual. He brings a very different attitude and take on being the CEO than his predecessors, Neil Patterson and Brent Schaefer. He is is already hitting the road. On Monday, he was visiting a client on site. So he is planning to, he's got a list in his first 90 days of places to go visit and clients to go interact with. His focus, and it became very evident and is very different than his predecessors, was routinely talking with end users. He shared video of his visit to the client he went to on Monday at a Cerner town hall yesterday. And he was talking with an OBGYN about the things that she has, what's good and what's bad about Cerner. So he's out there listening in a different way than we've seen before. And that's encouraging to me as a physician that's been here for 15 years. And then, somebody asks, we had in the town hall, I think it was a very insightful question. Somebody asked, Neil was a visionary, Brent was an operational guy. What are you? And he said he's a healer. And that was an interesting take and can be interpreted in a lot of different ways, in that he's a healer inside of the organization, from how do we continue to grow and how do we mend the internal pieces of Cerner, but that, fundamentally he is a physician as well. And that his focus is, and another insightful line of questioning was, who's our competition in the market? And he said very clearly, diabetes and COVID and other things that bring a very different lens to how Cerner thinks about the world. So we're excited to have him on board. He is very open to meeting with individual associates and obviously with our clients, and that is a departure in a different tack than others have taken. That's big news number one. The big news number two, we have our Cerner Health Forum virtual going on next week. Revenue Cycle Management Forum is this week, and there's other specialty forums going on over these next couple of weeks as well. So do welcome you to come and join us at the Cerner Health Forum. Always a good time of year, still very different being virtual as opposed to everyone managing to come into Kansas City and interact with us there. So lots of good sessions. At a minimum, please register. And what that does for you is it gives you access to the on-demand sessions and recordings as well. And we'll be sharing a lot of information. A big announcement today even that Cerner has, and it was announced at our Revenue Cycle Forum this morning and into a town hall inside of Cerner this morning as well, that Cerner's patient accounting system, the go-forward approach, is going to be the Relevate product. Revelate, I still can't say it correctly because it's brand new. And it's a slightly different tack. It's using the core Sorian financials, but on the patient accounting side, but using the Health Extension Platform, or HEP, which allows for orchestration and other automation type endeavors in a more robust way. So for those folks that may be on Millennium Rev Cycle today, there will be a path for upgrade, which will actually be no cost, so that you get the latest and greatest from how are we evolving our view on the revenue cycle in the world at large. A couple clients that have been using it. I think one is on this call relatively frequently. Does Charleston join this call, Brian?
They're not on this week, but
okay.
They have in the past. Yeah.
Okay. Yeah. So Charleston Area Medical Center and Baycare down in Florida have been working with Cerner on kind of how do we take that Sorian core, use it with Millennium, especially Millennium on the front end from a registration and scheduling perspective, and then provide a seamless workflow through all of the solutions so that patient accounting has not only that clinically driven revenue cycle feel, but then also some of the extensibility and automation possibilities that are really there with Sorian, more so than Millennium Revenue Cycle. So that will stir up a flurry of new things for everyone to discuss. And getting back to your original question, Brian, around what's new in the physician space, that affects everybody. So between Feinberg, CHC, and this new today announcement around revenue cycle and the go forward strategy, there's a lot of things going on from a Cerner perspective. I will say, kind of on a fourth point, I've gotten quite the opportunity, and so has Mandy, to interact with some of Cerner's new client leadership. And the direction and and the focus is new and refreshing also. The particular gentleman who's in charge of the U.S. client group is Bob Kapanik. Bob has visited Covenant with me and Mandy, and he brings a very put dates on things kind of approach. So he's pushing our internal teams to become more transparent and deliver code faster and on time to everybody. And Dr. Feinberg also reiterated that as part of the core for Cerner going forward. So lots of changes at Cerner from a leadership perspective, from an attitude perspective. I am cautiously optimistic in all those regards, and will be here to help and as you folks need, if you need to reach out to me or your CAE, please do, and we'll continue those conversations. So lots of updates from a Cerner perspective, Brian.
Yeah, no, I appreciate that. And certainly in the past week, even here, a lot of big changes that are going on that are going to be hopefully all positive impacts for everybody.
Agreed.
Great. Well, thanks everybody for running through the updates here on your individual sites. I did want to open it up here, see if anybody has specific questions that they wanted to ask of anybody else who's on here. I know we already had the VTE discussion, but any other discussions? So one that I had pulled forward, and I know some sites have talked about it previously, but was the use of the patient lists and the handoff lists. And I know that can be a laborious process for the providers to go and build those. So just wanted to put that out there to the group, see how others are handling those, and how do you make those lists each day with the providers.
I mean, that definitely can be a complex topic, and it probably depends on, are you talking about the provider group build, or, we had to do a ton of cleanup and continue to do ongoing maintenance of just making sure our provider groups are built correctly, so that they can pull the group list either through the old patient list functionality, or more importantly, through the new provider handoff, which we rebranded at our facility as dynamic patient list. But, it also depends on how you're using. Are you using attending and admitting as the, source of truth on the inpatient side, or are you using primary contact? And we are using primary contact. We asked the physicians we update it automatically by the patient status order for attending and admitting the first time. And then after that, it's up to the service to update, but we do allow access for our hospitalist program coordinators, for example, to work on setting those lists up first thing in the morning before provider handoff takes place at 7 a.m.
Great. Yeah, I know that's a broad topic there. I know that has just been asked before for me to connect some clients and allow them to talk through that. So I just wanted to kind of open it up to the overall group to see if there's anything else we wanted to share. So I appreciate that, Dr. Halford.
Hey, Brian,
Sure.
This is Ray. We can share what we're doing also. I mentioned a lot of work that we're doing on the women's front. One of it is customizing the patient list. So we have our kind of like in-house Cerner experts that is able to take the base build from Cerner and customize that list to the physician requests, like adding different lab results, adding different phone numbers, and all that customization. We were able to do that, and we can share with you all what we have done so far. And of course, the request still is to be able to print it, which I think there's still some physicians who are still kind of reliant on that paper copy, but we had the ability to customize the patient list. Like I said, we can share with the group what we have done so far for that, specifically for our OB docs.
Yeah, that would be great. Ray, I mean, if there's anything specific or screenshots or anything, I can always attach these to the notes when we send them out, and that's usually how I can distribute things. But if people want to reach out to Ray directly, I know she's on this email thread, or you can just reach out to me and I'll get you connected.
Yeah, I'll send that screenshot, Brian.
Okay, thank you. And the other item that I had, and this was a pull forward from the last time, is starting to get into operational reporting and using Healthy EDW for some of the reports, and then really how organizations have created like a data governance structure in order to manage the reports that are coming through and the tools that are available. And I know that's a very big topic to put into this meeting here, but I'd be interested in knowing, and I'm sure that others would be, at how organizations are approaching data governance and the requests and sort of the structure to handle those type of reports and requests that are coming in.
This is Dr. Halford from Covenant Health. We have spent a lot of time on data governance and analytics. We are not currently live with the EDW. We're still kind of in that discovery process. We do use healthy intent, healthy analytics, healthy care and healthy registries, and are looking at, what would it look like moving forward if we were utilizing the EDW. But, I'm happy to talk through the governance piece with others if people want to do that, and kind of where we're at on our journey and what we feel like is important for the future.
Yeah, I mean, I think data governance is important sort of regardless of the tool that's in use, but the process is always interesting to hear about. So if you wanted to go into that a little bit, that'd be great.
Sure. We have actually we meet this afternoon. We have a monthly performance analytics oversight, which is our really our highest level of governance for data and analytics, and that has our chief medical officer, our chief nursing officer, myself, and our senior vice president of finance, and then just some additional directors across the corporate organization. We do have some facility representation, both from our clinics and from our hospitals. And then underneath that, there are several working committees. We've got a bunch of team. We've got the IT team that, works on reports in Cerner, but also works on data feeds to third parties. And then we've got some of our financial systems that look at the productivity and charges, and then create dashboards for our service lines. And then we've got all these quality reporting, right? And then a lot of the quality is moving to more electronic with ECQMs and, supported by the IT team. So what we really tried to work on is how do we decrease all those silos and get people to work together. And I think what we found through that process is there was a lot of learnings on one person was already pulling this, and it was easier to do it this way. Or, why are we doing it two different ways? We've got a lot of redundancy. And so just by kind of pulling out the silos and getting all those different reporting segment leads together, they meet on a 2-week basis and then roll up to our performance analytics oversight for approvals, and then kind of status updates and then strategic decisions.
That's great, and that's interesting about, as you started talking, you found a lot of the redundancy, which I would sort of expect, but that's great that you're able to kind of smooth out some of that as you put that structure into place. thanks for walking through that. Does anybody else want to talk about structure that they have in place for data governance? All right. I know that's a big conversation, and I know a lot of organizations are still in the infancy stage of putting that together. So, Dr. Halford, appreciate your experience in guiding the way, leading the way for some other organizations potentially.
Sure. If anybody wants to chat, just let me know.
No, I appreciate it. Are there anything else that people wanted to bring up? Those are two items that I just want to pull forward that we've had on our list for a while, but obviously this is your meeting. Want to keep it open here for anything you want to talk about? All right. Well, if there's nothing else, I'm looking forward the calendar here. Looks like our next meeting here would be December 8th. So I will get that on the calendar for us. That way we can make sure that we've got that out in plenty of time. You can block it off. And then if you have a CMIO counterpart or a nursing leadership counterpart, we do have a meeting on November 10th that they can join as well. Just send the name to me and Patty, and we can make sure that they get added to that next one as well. All right. Well, thanks everybody for joining here today and kind of talking about everything that you're doing. And as always, feel free to reach out to me if you've got any questions or you need to get a connection to somebody. We can open it up through the larger group as well.
Thanks,
Thanks
Brian.
again, everybody.
Right.
Thank you,
Have a good
Brian.
rest of the day.